Hey everyone, Dr. Talley here with Spero CBD again. So today we're going to be looking at CBD and mental health. For those of you who haven't quite heard, this month is Mental Health Awareness Month. Something that I feel that doesn't get enough recognition and support. But recently, I feel that course has started to change, and there started to be more awareness towards um, mental health and also those suffering with mental health issues, and trying to offer them more support and more awareness, letting them know that they're not alone when it comes to those that have mental health disorders. So today we're going to look at a couple of things. So we're going to start out with prevention. Obviously, there's a component of genetics to this. If something runs in your family, depression, anxiety, bipolar, schizophrenia, etc., it's going to rely a large portion on that. But there are still things that you can control on your own in terms of your environment. So obviously, surrounding yourself with positive individuals and a positive environment will allow you to improve your mental state overall. We tend to focus on the things that are around us in our environment. If you put yourself in negative situations and harmful situations, then your mind will tend to follow that. You have to make sure that you're trying your best to put yourself in the best situation. These aren't things that can absolutely prevent it from happening or cure a mental health disorder, but these are things that can give you the best chance. So obviously seeking out positivity and other individuals that are positive in your life will be helpful. So the next thing is trying to find a hobby and something that you can dedicate, something that you're passionate about, a portion of your week. So even if it's just 15 to 30 minutes a day, a few times a week, it'll still be helpful for your overall mental well-being to do that, so to allocate that time for your own personal growth. The next thing here we have is to avoid drugs and alcohol. This obviously is a no-brainer. You know, you can do alcohol in moderation. There are people that socially drink, and there's absolutely nothing wrong with that. But when you're tending to try and do it more frequently, and obviously illicit drugs are always a bad idea, these you become more dependent on them. So even though they have depressant effects and usually they make you feel somewhat relaxed while you're doing them, when your body goes into a short withdrawal state after you've stopped taking the or the substance, then you're going to not feel quite as well, and you actually might heighten forms of anxiety or worsen depression. These things are basically like a temporary band-aid. You will take them, feel better temporarily, but once you're back to normal, no longer under the influence, you're not going to feel that well. So the next thing that I kind of express, and this isn't just for mental health, but this is just for overall well-being for people, is trying to stick with a daily routine. Obviously, there's going to be days that will change. Maybe your weekend routines are slightly different, but having a set routine in place is something that can be helpful. It takes the guesswork out of the day. You kind of know what to expect ahead of time. And something that I do that I find personally successful for myself is, instead of looking at each individual day with a list of tasks to get through, I try and schedule out a week block at a time. That way you can allocate fun things into your schedule, allot time for spending time with family, because we all know how it feels to start a day with a long list of to-dos, and then you end up checking all your boxes, but at the end of the day, you really think, I didn't do anything that was of real value to me. When you do this week approach that I try and do, you can allocate time for things that you really want to focus on, things that are actually important to you, because we all have a laundry list of things to do that aren't extremely important to get done, just something that seems more urgent that needs to be done. So if you can try and prioritize your needs and your wants and make sure you actually take time out of your week to enjoy your life, you're going to feel much happier and more fulfilled knowing that you've spent some of the time that week doing something that you actually wanted to do, as opposed to just doing mundane daily tasks and checking off boxes. The next thing, and this is something that gets stressed on a lot, is adequate sleep. So everybody, again, is a little different. Some people don't need quite as much, but the average amount of sleep suggested for each night is about 8 hours. There's studies that show long-term health issues can occur for those that go through chronic periods of sleep deprivation or short times of sleep in the evenings, as well as a lot of times there's health concerns for overnight workers, even people who might get 8 hours. If they sleep during the day, there's some information out there to suggest that they're more prone to chronic diseases by working the graveyard shift or the night shift. So getting adequate sleep and, like I said, trying to stick that into your routine is something that can be very helpful to you. It allows you to recover from the day of work that you've just done, and then also, more importantly, it helps you be rested so that you can take on the next day. Now, this is also something that people hear about quite frequently, but healthy diet. You have to be able to provide your body with the nutrients that it needs to help with neurotransmitters in the brain. And also, nobody feels good after eating a Big Mac or some type of greasy meal. So there's nothing wrong with eating those things on occasion. You want to go out and have fun, that's fine. Eat something that you think is good. No problem with that. But trying to have the staples of your diet be healthier choices, lean meats, fruits, vegetables. And then of those meats, try and get things that have omega-3 fatty acids in them, such as fish or salmon, things like that. And then obviously the last thing is exercise. This doesn't have to be super intense. You don't have to be going out doing CrossFit, but the more intense, the better. Trying to do at least 30 minutes a day for at least 3 days a week. And like I said, it doesn't have to be anything too crazy. Going out for a walk can be very helpful for you. And tell me that you don't feel better when you take time away from whatever you're doing, whether it's work or chores around the house, and you get outside and walk around. You usually do feel better. So just trying to work that in to your week is also a little bit easier. When we go back to what I said earlier, if you plan out your whole week, you can try and work in those 30 minutes each day. You feel like you have a little bit more time to play with throughout the week when you do it a week at a time instead of planning your day just one day ahead. Now, the next thing is, how can we reduce the stigma around mental health? Now, and this is something I kind of touched on when I first started this session here. I think that there's been a much bigger movement with social media platforms and other individuals sharing their personal experiences, highlighting the issues with mental health awareness. And I think that what's been going on recently has been helpful. There's been light drawn to the fact that mental health is a big concern. There are a lot of people out there struggling with it, and it's rather ubiquitous in the general population. So I think before, where people kind of felt more isolated, they didn't know how many other people were suffering from it, it was harder for them to come forward and to seek help. So I think that the two factors that really caused the stigma were, one, people not being able to know how common these are and not seeking out help. And then number two was, a lot of times, even in the medical field, it's hard to dive into mental health of patients when we're usually so focused on the physical body. And a lot of times doctors have a hard time fitting that into their schedule with an appointment. As you know, insurance companies continue to cut reimbursements, and hospitals or insurance companies want you to do more work and less pay. It becomes harder and harder to fit the amount of work in to what used to take less time. So now we're in a situation where physicians are trying to do the best by their patients, but it's also, there's a lot more time constraints now, and then also throw on top of that paperwork, which takes up an unreasonable amount of time that takes away from actually being able to care for the patient, which is what we all went into medicine to do. So I think that as I had mentioned, there's been more focus on awareness and more support for mental health, which I think is a great thing. It's become more visible to the general public. So those that are suffering from it know that it is much more common than they believe, and then they should feel more assured to approach their healthcare providers, physicians, etc., to seek out the help that they need. And then one thing that, and particularly this applies to any profession, any employee can experience burnout. This is something that we see in medicine all the time, and this is what I was hinting at before. There's always times where somebody overseeing you, whether it's the government, your boss, the employer, expects more and more out of you with less and less resources, or trying to get more out of every second of your time. And sometimes it becomes compromising, because as physicians, we really want to care for patients, but there's also a time component to an appointment and a visit, and there is always the business side of medicine in terms of not flipping a profit, but keeping enough or making enough money to be able to keep your doors open, and that's something that people don't really talk about so much. So we want to help as many patients as we can and give everybody their time, but that they need for their appointments. But sometimes we can only squeeze so much out of the allotted time, and that puts us into a dilemma of burnout, where we really want what's best for our patients, but we feel this pulling in the other direction that we need to see the next appointment. So it's stuck between a rock and a hard place, especially as healthcare continues to change. The last thing here is the potential connection between CBD oil and mental health. Now, I continue to always read up on this and see what type of clinical trials are out there regarding CBD, and particularly for our topic today, mental health. So I just did another search today. There are trials that are enrolling now for CBD and how it may help with things like chronic pain, anxiety, depression, bipolar disorder, Parkinson's, and memory disorders. And that's just a short list. There's a ton of ongoing research. Either they are still recruiting patients or not yet recruiting, and they're setting up the stipulations for the trials. But I believe we're going to have a lot better quality data regarding CBD and who it can actually help in the next 2 to 3 years as more and more studies come out, that data gets compiled, and we can actually draw conclusions from that data with human trials, as opposed to some of the information we have now, which seems to show that CBD works very well, but a lot of it is consumer reports, as well as smaller trials in humans, and then also animal trials and studies. So while there is some data out there with supporting CBD and a lot of happy consumers that have said how well it's been working for them, I believe that we're going to have much more concrete data here in the very near future. So I just want to give a shout out to everybody this month for mental health awareness, and for those who have mental health disorders, I hope that you're receiving the care that you need, and just know that these disorders are much more common than you believe, and you should always reach out to your healthcare provider to get the help you need, because there are treatment options available to help you out. You should never feel alone. Regarding CBD, if you're looking for a quality premium CBD product, check out sperocbd.com. We have a ton of informational, educational content there, as well as some of the highest quality CBD you're going to find on the market with third-party testing, and you can look all those results up for yourself. So feel free to visit the website. I want to thank you all for tuning in today, and I'm going to look back here, see if we have any questions. I'm going to give a wave, everybody joining in. Thank you all for joining me today. I appreciate all your support. It's great to see everybody. All right. Well, I don't see any questions, so I'm going to go ahead here and sign off. But thank you for your time today. I hope this helps. And if you have any questions, feel free to visit the website or write to us, and we'll do our best to get back to you. All right. Thank you. Have a great day.